Hello students, today we will discuss about the formation of the lateral wall of the nose. Now in today's lecture we will mainly discuss about the bony framework of the nose and its lateral wall. So when you will see the front of the face, you will see that this is your lateral wall of the nose and here you will have the midline septum. Now today we will discuss this lateral wall, and you can see this lateral wall is related with the number of air sinuses which are present in the skull bones. Now when you will see the external surface of your nose, you will realize that this is the lateral wall which you are able to see here. Now this lateral wall which is present here is made up of not only the cartilages, but there are n number of the bones which are contributing in the formation of this lateral wall of the nose. So what are the cartilages contribute in the lateral wall? So there are three types of the cartilage. One is known as lateral nasal cartilage or upper nasal cartilage. Now when you will see the section of the lateral wall, you can see that this is the lateral nasal cartilage, or it is also known as upper nasal cartilage. Now then the second one is known as major alar cartilage. Now this nasal alar or major alar cartilage is here. Now this alar cartilage is forming the tip of your nose. Now behind this there are few tiny cartilages, and here you can see that these are the small cartilages which are contributing in the formation of lateral wall of nose. Now in this section, when you will compare both, this is the external surface of the lateral wall of the nose. Here you can see that this is the inner surface. Now on both the side you can appreciate the cartilages. This is your alar cartilage. Now this alar cartilage which is going to form the tip of your nose and lower part of the lateral wall of the nose. Now this upper cartilage is known as lateral cartilage of your lateral wall. Now here you can see these are the small tiny cartilages. So when you are having the lateral wall of the nose, this anterior-inferior part of this lateral wall is made up of cartilages. The remaining lateral wall is made up of bone, but when you will see the external part, you can see only a very small portion of the bony part of lateral wall. Remaining part of the lateral wall, which is made up of bones, is not visible externally. For that you have to take the median section of your nose. Now what are the bones contributing in the formation of lateral wall? So there is a list. So first you should know the name of bones. One is nasal, then you will have the frontal process of maxilla, lacrimal, then you are having the contribution of the ethmoid bone where you have the conchas and the labyrinth, then you will have inferior nasal concha, there is a perpendicular plate of palatine bone, and lastly the medial pterygoid plate of your sphenoid bone. So when you will see this lateral wall of the nose, now my dear friends, when you are reading the lateral wall, you first have the orientation of the lateral wall in the skull. Now you have to understand that these are the bones which actually articulating all around the major bone, and that is known as maxilla. So when you will see the maxilla, now this maxilla is a major contribution in the lateral wall of the nose, and the maxilla is having a medially placed large defect, and that defect is known as maxillary air sinus. Now the several bones contributing to close that opening of the maxillary air sinus, and thereby they ultimately form the lateral wall of the nose. Now here you can see that this is the section on the medial surface. You can see the maxilla. Now this maxilla is having here a gap. Now this is a very big opening, and this is a defect is known as maxillary sinus. Now you can see that this is the lower border of the maxilla where you can see the upper teeth. This is the part of the hard palate. Now what will happen? Now this part of the maxilla is going to closed or covered by all around the bones. Now you have seen that in the upper part you will have here, this is become the floor of the orbit. So what will happen that you will have the bones all around. Now posteriorly you will have the plate is known as medial pterygoid plate. So you will have the sphenoid bone, though that will come here. From the sphenoid bone you have a perpendicular plate is going downward, is known as medial pterygoid plate. So what you will realize that this lateral surface of your nose, which is known as lateral wall of the nose, it extends posteriorly towards the medial surface of medial pterygoid plate. Now when you will have the perpendicular plate of the palatine bone, it is the comes on the posterior side. Now this is the perpendicular plate of palatine bone. Now whenever the students are reading this word perpendicular plate, they always confuse that it is a midline structure. Now my dear friends, the perpendicular plate of palatine is not a midline structure. The perpendicular plates are present on both right and left side. Because this is a paired bone, you will have the right palatine bone, you have the left palatine bone, and these bones are L-shaped. So one L will come on the right side, one L will come on the left side. Now this part is known as perpendicular plate of palatine bone. Now this perpendicular plate of palatine bone articulates here in the posterior part of the maxilla. Now the posterior border of this perpendicular plate is going to articulate with the medial pterygoid plate of sphenoid bone. So when you are having the lateral wall of the nose, bones form bony components, you have to first understand that perpendicular plate of palatine bone comes posteriorly to this maxillary sinus, and beyond the palatine bone you will have medial pterygoid plate. So medial pterygoid plate will come here. The Sphenopalatine foramen is present at the top of the perpendicular plate, provide a portal for the neurovascular communication between the nasal cavity and pterygopalatine fossa. So here this area, if you will see this plate, on the upper part of the plate you will have a notch. Now this notch will later on convert into the foramen, and this is known as Sphenopalatine foramen. So this is again the important concept to understand, that whenever you are reading the pterygopalatine fossa, you will realize that the terminal branch of third part of maxillary artery enters into the nasal cavity. Now how it enters into the nasal cavity? Through this gap, and this is known as Sphenopalatine foramen. Then the labyrinth is known as lateral masses of ethmoid bone. They occupy the much upper part of the maxillary hiatus. So in this diagram you have to first understand the relation of palatine bone with the lateral wall of the nose. So first important thing, you should understand that this is the maxilla. Now this is the maxilla of my right side. Now from the medial surface you are seeing this maxilla. So on the medial side you are able to see the opening of maxillary sinus. So this is the opening of maxillary sinus. Now this opening of maxillary sinus posteriorly is bounded by the perpendicular plate of your palatine bone. Now here you can see that this is the perpendicular plate. Now this perpendicular plate is having the vertical orientation, and there is a horizontal plate. Now this horizontal portion is going to form posterior part of the hard palate. So there are two such bones are present, one is on the right side, one is on the left side, and these are the horizontal part. This is known as perpendicular plate. In the upper part of perpendicular plate you will have this gap is going to form Sphenopalatine foramen. Now if you will put this plate here, you will realize that this is the area for Sphenopalatine foramen, and this is the perpendicular plate. Now this plate is having the turn horizontal portion somewhere here. Now when you will see posterior to this part, now see this is your Sphenopalatine foramen. This red color plate is nothing but this is the your perpendicular plate of palatine bone. Now, behind this you are having the medial pterygoid plate. What is that? Medial pterygoid plate. This is a part of sphenoid bone. So, now dear students, you have to understand with this part that when you are seeing the dry skull in the norma basalis, you will have the two plates of sphenoid bone. This is lateral pterygoid plate, this is medial pterygoid plate. And each plate is having two surface, lateral surface of lateral pterygoid plate, medial surface of lateral pterygoid plate, lateral surface of medial pterygoid plate, and medial surface of medial pterygoid plate. Now, whenever you are having these four surfaces, you should have the idea that this lateral surface of lateral pterygoid plate give rise to the attachment to this lateral pterygoid muscle, while this medial surface of lateral pterygoid plate give rise to attachment to the medial pterygoid muscle. While what about the medial pterygoid plate? Now, when you will have the medial pterygoid plate, here you will have the origin of tensor velli palatii, which is present on the lateral surface of medial pterygoid plate, and then it will take turn around. This process is known as your hemulus, pterygoid hemulus. What comes on this surface? Now, this surface is nothing but this surface, which is the medial surface of medial pterygoid plate, covered by the mucosa. And that mucosa is nothing but you are dealing this surface that will continue with the respiratory mucosa. That means it will continue with the lateral wall of nose. So, this is very important concept to understand that these posterior openings of nasal area, which are known as choana, are actually bounded posterior most on the lateral side by the medial surface of medial pterygoid plate, and medial pterygoid plate articulating anteriorly with the perpendicular plate of palatine bone, and palatine bone articulating anteriorly with the maxilla. So, here this is the maxilla bone, clear. Now, you will have this norma basalis. Now, in this norma basalis, you all know that there are two posterior opening of nasal cavity. Now, again you can see that this is the medial surface of medial pterygoid plate. So, if somebody will ask you what structure or what is the role of this medial surface of medial pterygoid plate, you have to reply in one word that it is covered by the mucosa and it is become the part of lateral wall of nasal cavity. Clear? Now, when you will move to further orientation of this medial pterygoid plate, so you now realize that medial pterygoid plate comes here. Now, this medial pterygoid plate is later on become the part of this lateral wall of the nose. So, here you can see this is the posterior boundary of the lateral wall of the nose, and it is continue anteriorly with the remaining surface of your lateral wall. So, my purpose is to make this concept very clear that there is a major contribution of the maxilla. Behind the maxilla, you can see here this red color bone, and this bone is nothing but this is your perpendicular plate of palatine bone. Behind this plate, you will have this yellow color area, and that is your medial plate of your sphenoid bone. Now, what are the other features of the lateral wall of the nose? Now, the lateral wall is divided into the three areas. Posterior part present the three projection. Now, the posterior most part is having the projections are known as turbinates or conchas. Now, there is a space which separates the conchas, and the space are known as meatus. So, you can see that this is the one projection, this is the second projection, this is the third projection. Now, below the projections there are the spaces, and these spaces are known as meatus. Now, anterior to this rough area, that is the nasal concha, the lateral wall is smooth, and this smooth part is further having the two area. One is known as atrium, another is known as vestibule. So, vestibule is this part which is actually at the entry, and just above the vestibule, this smooth portion is known as atrium of nasal cavity. So, when you are reading the lateral wall of the nose, you will find the three areas. This is the rough area, which is posteriorly placed. This is the anterior smooth area, which is having the lower portion is known as vestibule and upper portion is known as atrium. Now, what are the important features of the vestibule? This is very commonly asked question. Vestibule is lined by the skin, and this skin contains specialized hairs which are known as vibrissae. Now, these hairs act to filter the foreign particles. The lateral wall of the vestibule is formed by the ala. So, here you can see that this small portion is known as vestibule, and this vestibule is lined by the skin. So, the epithelium become like the skin, which is keratinized, stratified, squamous epithelium. The laterally you will have the another area which is known as atrium. Now, the line of demarcation between the atrium and this vestibule is known as limon nasal, which is a mucocutaneous junction. So, here in this diagram you can see this curved line. Now, this curved line is known as limon nasal. Now, above the limon nasal you are having the mucosa, which is respiratory in nature, while below this you will have the area is known as vestibule lined by skin. Now, what are the features of atrium? So, the area of atrium lies anterior to middle meatus. So, middle meatus is the area between the middle and inferior concha, and this area is known as atrium. Now, in this atrium, the lining epithelium is the respiratory epithelium, which is the pseudo-stratified ciliated columnar epithelium with goblet cells. Now, this mucus secretory epithelium is providing sticky surface, and this is helpful to entrap the inhaled particle and microorganism. And the cilia are responsible for the entrapped material push backward in towards the nasopharynx. So, whatever the mucus is there, this mucus entrap the microorganism, and cilia are helpful to push that material towards the nasopharynx through this posterior opening of nasal cavity. Now, what about the conchas and meatuses? The form of many features of the lateral wall. Now, the conchas are also known as terminates, and these terminates are curved bony projection which are directed downwards and medially. So, when you will take the section, you will find they are curved section and they are directed downward and medially. They are covered by the mucosa, and below and lateral to each concha there is a corresponding meatus, or the gaps are present, and from above downward you are having the superior, middle and inferior nasal concha. Now, the superior and middle nasal conchas are projection from the medial surface of labyrinth of ethmoid bone, while the inferior concha is an independent bone. Now, this is the question again for your exam. This is very commonly asked question, and the students are confused that they think that there is a single bone from which the three projections are coming, but it is not like that. There is a one bone which is giving the two projection, and the third projection is an independent bone. So, this independent bone which is giving a projection is known as inferior concha, while the superior and middle projections are the part of ethmoid bone. So, the superior concha is the smallest one, and inferior concha is the largest projection of these three. Now, in this diagram, you have to appreciate that this is the superior concha. We have cut the superior concha, cut the margin of middle and margin of inferior concha. Now, after cutting these projections, you can see the clear cut large spaces below the respective conchas, and they are known as meatuses. So, when you will remove this conchas, then and then only you can appreciate the surfaces which are actually known as meatus. So, if we will put the conchas in original position, you can see that you can appreciate the projections, but below the projections you cannot see the surface. So, after cutting this, you can appreciate the features in the lateral wall of the nose. So, you have to understand that these features of the meatuses can be appreciated only after cutting the conchas, because once the conchas will placed, these features will not visible. Now, this is a side by side picture of the lateral wall, where you can see again that when you will cut these part of the conchas, you will find the major features in this area, which is known as middle meatus. So, meatuses are the passages or the recesses beneath the respective conchas. They visualized once conchas are removed. Inferior meatus is the largest and it lies below the inferior concha. Superior meatus is smallest, it lies below the superior concha, and a triangular depression above and behind the superior concha is known as sphenoethmoidal recess. So, this is again the question of your exam. What is sphenoethmoidal recess? So, you can see that this is your superior concha, below that you will have superior meatus, but above and posterior to the superior concha there is a space, and that space is known as sphenoethmoidal recess. So, there is a small recess above the superior concha and the respective recesses are below your respective conchas. Now, the middle meatus lies under the middle concha and it presents following features. Now, in my class of ethmoid bone, this is my sincere suggestion to all my viewers that please go through this ethmoid bone class, where you will find the detail of all these features of your middle meatus, because whatever the features are present in middle meatus, they are nothing but they are actually the part of ethmoid bone. So, what you are able to see is ethmoidal bulla. Ethmoidal bulla is nothing but it is a elevation produced by the underlying ethmoidal air sinuses. Then you will have hiatus semilunaris. Hiatus semilunaris is a gap or semicircular groove which is present between the ethmoidal bulla and uncinate process of ethmoid bone. And lastly, the infundibulum. Infundibulum is actually the anterior part of hiatus semilunaris, which will give rise to a channel that is known as frontonasal duct to drain the frontal air sinus. Now, in this diagram, you can see that this elevation is known as ethmoidal bulla. Now, below the ethmoidal bulla, you can see that there is a channel, and this channel which is visible here is known as hiatus semilunaris. So, this is the hiatus semilunaris. Now, below the hiatus, this part is known as uncinate process, which is not visible here because it is covered by the mucosa. Now, in this diagram, you can appreciate these features. This is the coronal section where you can see this is the ethmoidal bulla. Now, this ethmoidal bulla is a feature of the middle meatus, which is this area. Below the projection is known as middle concha. So, this is the middle concha. So, the area which is hidden by this is known as middle meatus. So, in middle meatus, you can appreciate the bulge, and this bulge is known as your bulla ethmoidalis. Now, this bulla ethmoidalis is having underlying sinuses, which are the sinuses of ethmoid bone. Now, what are the openings you are able to see in the middle meatus? Now, again, if you will see the class of my ethmoid bone, we discussed the openings in detail. So, what are the openings you will find? One is the frontal sinus, second is the anterior and middle ethmoidal air sinus, and lastly the maxillary sinus. So, these are the three openings, which is again the question for your exam in the middle meatus. So, in this middle meatus, if you will see the openings, the anterior and middle ethmoidal air sinus opens on this bulla itself. While when you will see the hiatus semilunaris, in the hiatus semilunaris, you are having the two openings. Now, in this whole length of hiatus, you are having the two openings. One opening is anteriorly and one opening in its posterior part. Now, this posterior opening is for the maxillary sinus, while the anterior opening is for this sinus, which is known as frontal air sinus. Now, for drainage of the frontal air sinus, there is a duct or a channel, and this channel is known as frontonasal duct, which is passing through the labyrinth of ethmoid bone. So, the anterior end of the hiatus semilunaris is having a passage, and that area which is having the opening is known as infundibulum, and from the infundibulum you will have a channel, and this channel ultimately drains the frontal sinus. Near the posterior end you will have the opening of maxillary sinus, while the anterior and middle ethmoidal sinus opens on the ethmoidal bulla itself. Then what about the inferior meatus? The inferior meatus is again a passage below the inferior concha, and it receives only one single opening, that is known as nasolacrimal duct, and this duct opens near the anterior part of this inferior meatus. Now, this is the question, that this nasolacrimal duct opens in which part of inferior meatus? So, answer is anterior part of inferior meatus. Now, there are two more openings. One is below the superior concha, is known as superior meatus. One is above and posterior to the superior concha, is known as sphenoethmoidal recess. Now, this superior meatus receives a single opening, and that is known as posterior ethmoidal air sinus, while this sphenoethmoidal recess receives the opening of sphenoidal air sinus that will open into this sphenoethmoidal recess. So, whenever you are reading the openings into the different spaces of the lateral wall of the nose, there are four areas where you have to remember the opening. One area is above the superior concha, one is below the superior concha, one is below the middle concha, and one is below the inferior concha. Here you will have one opening, and that is nasolacrimal duct. Here you will have one opening, that is sphenoidal air sinus. Here you will have one opening, that is posterior ethmoidal air sinus. And in this portion, you are having the four opening. One is frontal sinus, another is maxillary sinus, and the two anterior and middle ethmoidal sinuses. So, this is the important thing which you always keep in mind whenever you are reading the conchas and meatuses, which are important features of lateral wall of nose. Now, what is the Sphenopalatine foramen? Now, whenever you are reading the pterygopalatine fossa and the lateral wall of nose, at that time this foramen comes again and again. You have to understand this concept that there is a connection between the pterygopalatine fossa and this lateral wall of the nose. Now, suppose this is the nose. On both the side of the nose, you will have pterygopalatine fossa. Now, there is a gap is present here. Now, this gap allows the structure to pass from pterygopalatine fossa into the nasal cavity. Now, this gap is present on the upper part or notch of your perpendicular plate of palatine bone, and this part is ultimately going to articulate with the sphenoid bone. That is why this will become Sphenopalatine foramen. Now, this foramen is actually a communication between the pterygopalatine fossa laterally and nasal cavity medially. So, it is a communication between the nasal cavity and pterygopalatine fossa. Now, in this diagram, you can see the norma lateralis. After cutting this zygomatic arch, you can go deep where you are able to see the pterygopalatine fossa. On most medially, you can see this opening, and this opening is a opening of Sphenopalatine foramen. Now, when you will see the boundaries of Sphenopalatine foramen, you will realize that this Sphenopalatine foramen posteriorly bounded by the sphenoid bone, while the major portion is nothing but the different parts of perpendicular plate of palatine bone itself. So, above it is bounded by the sphenoid bone, below it is by the superior border of perpendicular plate of palatine bone, and in front and behind is also the parts of palatine bone. So, basically there is a contribution of only two bone, sphenoid bone and palatine bone. That's why this area is known as sphenopalatine foramen, and this foramen allow the entry of sphenopalatine artery and nasopalatine nerve and superior nasal branches into the nasal cavity. So here you can see that this is your sphenopalatine foramen. Through this sphenopalatine foramen, you can see the artery is entering. In the same way, the nerves will enter and they will supply the nose, nasal cavity mainly. So whenever you are reading the sphenopalatine foramen, this concept should be very clear that it is present in the very posterior part of the lateral wall of the nose, and that is the entry gate of the nerve and vessels from the pterygopalatine fossa. Now this diagram is showing the difference between the nasal septum and the lateral wall. Now whenever you are drawing the nasal septum and lateral wall, there should be no confusion that nasal septum is a midline structure and it is smooth, while lateral wall is a rough area where you will find such projections. Another important thing is sphenopalatine foramen is a feature of lateral wall, not the nasal septum. And the second important thing is that when you will see the lateral wall of the nose, it is extending posteriorly towards this medial plate of medial pterygoid plate, which is not here. Clear? So whenever students are drawing these two structures in the exam, you have to keep these comparison, this difference in your mind, that septum area is smooth, while you will have the contribution of multiple bones and it is rough. And the second and most important thing is that in this formation you will find the vomer bone. Now vomer bone is here. Now this vomer bone is a major contribution in your nasal septum, but in the lateral wall, vomer bone is not having any contribution. Clear? So these are the few important things which you always keep in mind between the septum and lateral wall of your nose. So this is CT scan views of your nose. Now I told you that whenever you are having the projections, they are curly projections. So you can see that this is the projection which is having the lower round ends. So what is these? These are nothing but these are your conchas. So these conchas are having the gap below, and these gaps are known as meatuses. So sometimes you will have such pictures in your exam. In that you have to identify that this gap is become middle meatus, inferior meatus, this gap become the middle meatus, and this gap become the superior meatus of lateral wall, while this midline structure is the nasal septum. And above these meatus, these areas become the conchas. Clear? So whenever you have such images in exam, you should be able to identify the conchas and meatuses. So at the end of this class of the lateral wall of the nose, we discussed the bony framework, how the lateral wall is different from the nasal septum, what is the meaning of concha, what is the meaning of meatus, and which meatus receives which paranasal sinus. So this is all for today's class. Thank you.